The eyes are on the Jersey Shore. I am Vin Ebenu here at the Town Square Media Jersey Shore newsroom in downtown Toms River. As we transition from summer to fall, the allergies are following us, all sorts of things flying around, tree leaves falling down as well. I'm with a pair of allergists with Hackensack Meridian Health with offices in Brick and Wall, Dr. Bruce Decotiis and Dr. Chirag Patel. So, doctors, I thank you both for joining me as we still have some time left in summer and heading into fall and everything. So appreciate you taking out the time here today to start talking about some allergies.
Our pleasure.
Thank you for having us.
So I feel like typically at this time of year, towards the end of August, going into September, as summer goes into fall, a lot of different symptoms flare up for different people for different allergies, whether it's outside with trees and perhaps pollen, inside with dust, that's the sayings, spring cleaning, fall cleaning and everything. So what are some of the more common allergens that pop up around late summer and early fall that people are typically coming in for to try and either get some sort of medicine, treatment, allergy shot?
Generally what happens is in the springtime, the grass pollens and the tree pollens are the biggest culprit. In fall now, as we get into August, first week in August, around the 4th, we start with ragweed season, and that will go almost until the first frost. That and a half a dozen other prevalent weed pollens are the biggest pollens. We also have problems now, especially with changes in temperature and humidity and such. We also have problems with outdoor mold spores and those kind of things. Those are the main factors at this point in time. As people shut their houses up, however, and put their heat on and et cetera, then we start also having problems with dust mites and indoor molds, et cetera.
What are some of the, I guess it would depend on the individual, but what if somebody's having light to moderate symptoms, is there something that they should be doing to try and treat some of those symptoms, or even before they start feeling any congestion or itchy eyes or anything, any over-the-counter medicines, anything that you would recommend doing?
Yeah, so typically, depending on your symptoms, nasal congestion is primarily addressed by intranasal corticosteroids such as Flonase and things like that. Zyrtec, Allegras, or any of the other antihistamines like Claritin do actually help with some of these symptoms, especially if you had a history of having allergies to weeds. And you expect it to have symptoms going forward, then I would definitely start about a week earlier than when the pollen start precipitating earlier.
If somebody's never experienced, especially now, a year plus into the pandemic and everything, and with the variants coming out, if somebody's never really been kind of diagnosed with having allergies to any things, but they're experiencing some of those symptoms, what are some of the things that people should be doing to try and figure out whether it's just an onset of allergies that they're experiencing for the first time, or if it's something more related to, or maybe getting a COVID test to rule that possibility out?
We've been running into that a lot, and sometimes it's difficult. I mean, what you start off with is just the history. So if a patient has a clear-cut history of a seasonal problem and it's the season, it's more likely that it's going to be a allergy rather than an infection, a COVID or even the flu. However, symptoms also make a big difference. One of the things that can help you to differentiate is COVID doesn't cause itching. So if your eyes are itching and your nose is itching, and especially if you're sneezing a lot, chances are that's allergies. Now, we all know that that doesn't necessarily rule out that you could have COVID anyway. A lot of people have COVID and never know it. So there's a number of other symptoms that are factors. If you lose your sense of smell, for instance, unless you have an underlying sinus infection, that's more related to COVID. If you have aches and pains, for instance, that's more related to COVID. Allergies don't cause that. If you're extremely fatigued, that's generally COVID, although some seasonal allergy patients complain of fatigue and lethargy as well. So those symptoms are the things that help us to differentiate. Bad respiratory symptoms don't happen with allergies unless you have asthma. Okay, if you have asthma and allergies, then obviously that's going to happen as well. Chest pain generally doesn't happen with allergies. Fever, another big one. If you have a fever and you have symptoms and your eyes aren't itching and your nose isn't itchy and sneezy, it's more COVID. I mean, we've seen a number of patients who have come in who have allergies and have COVID as well. that's more for the doctor, I think, to make that determination. When in doubt, a test is quick, a test is easy and not tremendously inconvenient. So it's always best to get tested if you have a question. But again, if you have a history and you have typical allergy symptoms, as I just described, I wouldn't bother. So.
Now, when people are cleaning their houses, usually around the fall time, kind of that fall cleaning, right? Should there be things that, especially those who have a history of suffering from allergies, dust, mold, whatever inside, are there certain things that they should be doing? Should people wear a mask inside while they're cleaning? Should they be taking more of the nasal sprays or antihistamines?
Yeah, so if they've definitely had a history of having symptoms while doing these types of cleanings, then you can preemptively take some antihistamines to decrease the symptoms. Again, Flonase is a great medicine for nasal congestion or any of the intranasal steroids that are on the market. And obviously wearing a mask, especially with the dust mites, will definitely be helpful. With the molds, it's a mulch or the hay that seems to be the big problem that you have to watch out for.
Now, for just to hit on the point, if somebody hasn't necessarily gotten treatment in the past for having allergies and they haven't gotten the traditional allergy test to see kind of what you're allergic to, perhaps, and going into getting allergy shots once a month, once a week, and so forth. What is, if they make that call, what is that experience like if they're going in here summer, fall, trying to, and they know, and especially now, if they know it's not COVID, what is that testing experience like to try to figure out what somebody is allergic to or how much they're allergic to?
The great majority of patients who have seasonal allergies never come to the allergist and don't really need to, honestly. If you have well-circumscribed symptoms, meaning there's only a certain time of the year that you get your symptoms and it's repetitive and et cetera, and you respond to over-the-counter medications, back when I went in practice, which was over 40 years ago, everything was prescription. All of the antihistamines were prescription, the nasal sprays are prescription. Now, as long as patients know what they're doing, the great majority of patients with seasonal allergies can just treat themselves. And I'm not trying to discourage patients from seeing the allergist, but sometimes it's just not necessary. So the first way of treating it is really, at this point, believe it or not, debatable. Some allergists say it's taking an over-the-counter antihistamine like Allegra or Zyrtec or Claritin. Some allergists say it's using one of the intranasal sprays. I'm from the old school, so I generally try the antihistamines first. Intranasal corticosteroids, which is what those nasal sprays are, treat congestion, as Dr. Patel said, whereas the antihistamines really don't affect congestion unless you use a D, like Claritin D, Zyrtec D, Allegra D. Problem with that is those really strong decongestants also increase your blood pressure, so people with blood pressure cannot use them. And also they increase your heart rate, they cause palpitation, they cause sleep loss, et cetera, et cetera. So they shouldn't be used on a long-term basis with just about anybody, okay? If what I do, and again, that this varies from allergist to allergist to some degree, is if they don't respond to the antihistamines in a fairly short period of time, then I use the intranasal corticosteroids. It's really important to read the directions carefully and use them carefully, because if you don't, and if you spray the nasal spray like you would tend to, like this, all right, you're going to get, if you spray it onto your septum, you're going to get a nosebleed. And you'll have to stop the medication. And some people will have to be cauterized even. So it's very important to put your head down. We always say nose to the toes. And a little trick that you can do is, if this is the normal way that you would spray a spray in, but you see the angle of my finger, it's towards the septum. So what you want to do is spray this hand in the opposite nostril. Just cross your hands like that, put your head down and aim for the top of your ear, okay? So that would be the initial treatment for seasonal allergic rhinitis. There are other medications as well. You can add on a medication called Montelukast or Singulair that you can add on. If you have a runny nose, you can add on something called an anticholinergic, which is ipratropium. These are now we're getting into prescriptions, okay?
Great. And one other thing that you should prompt you to seek an allergist earlier is that if you're having recurrent sinus infections, those are some worrisome symptoms because they can sometimes lead to also lead to loss of smell and loss of taste and these types of things, and can also signal that there may be nasal polyps involved as well. So in those cases, it would behoove them to seek care from an allergist or their primary care doctor about this.
Just generally speaking, what are some home remedies that perhaps work outside of an antihistamine? Are there some natural things that people can do or drink or eat that would help with flushing out any allergens that's causing congestion?
Yeah, so I'm a big fan of nasal rinses. Nasal rinses are great. They, as long as you can tolerate them, because it gives everybody a very weird feeling because you're putting water into one nostril and it's coming out the other. The only care that I would take with that is make sure they don't use tap water, or if they have a well water, definitely don't use the well water. You definitely want to use either boiled water, or you want to use sterile water, and then do the mixing packs that you can do. And a lot of my patients do report that they have significant improvement if they use the nasal rinses correctly.
I think we hit on it a little bit earlier as well, but spring allergies kind of going from cold to warmer, if you will, that March to April, and then kind of towards the end with the fall allergies going from warm to cooler. Are there a lot of similarities with what allergens flare up in the spring and the fall, or is there a lot of differences between what bothers people in the spring as opposed to the fall?
As I mentioned before, also, we did hit on a little bit. They're really pretty much different, with the exception of the indoor allergens, which kind of are perennial in nature, but peak out during the times of the year when the doors are closed. But in the spring, it's mainly trees and grasses, and in the fall, it's generally more weeds.
Is there anything that people should be doing outside to combat that around their yard the best they can?
Pollens travel for hundreds of miles. And when I was at Brown doing my fellowship, we used to do the pollen count on the roof of a 15-story building. And we would see pollens from trees that didn't grow within 500 miles. So they actually travel a long way. I mean, if there is an oak tree in front of your house and the oak tree is pollinating, obviously that's going to be a pretty heavy load right there. But you really can't discern which of the pollens for the most part is causing your problem. In addition to which, listening to the pollen count, as I just said, is not necessarily representative of what you yourself are getting exposed to, because there's trees right around your house that are going to give you a much heavier load. And the trees are pretty prolific pollinators. I mean, the nature of the beast is people are always worried that they're allergic to flowers. Well, I mean, unless you stick your nose in a flower, you're really not going to be allergic to it, because the pollen is very large and it's sticky, and it's really made to get on the legs of insects, of bees, and be brought from one flower to the next. With trees and grasses and weeds and such, they have to make such prolific pollen numbers, as evidenced by the yellow sheen on your car every springtime, that by chance they're going to land on another tree and pollinate. So there has to be millions and millions and millions of them in the air in order to accomplish that.
Last question I have in terms of allergies here, and you could both chime in as well. As we go from summer into fall, what are some tips, pieces of advice you have for either somebody who has a history of suffering from allergies or those starting to experience symptoms along those lines, about either preparing for the fall season or what to do when the fall season hits and perhaps they start feeling some of those symptoms, and trying to make it as healthy and less congestion-filled fall as possible?
Yeah, so I would definitely start early in terms of pre-medications with Flonase and Zyrtec, especially if you know that you're going to expect certain amount of symptoms at this time. As we touched on before, for nasal congestion, I prefer to use the nasal sprays. You can add on Zyrtec or Allegra or Claritin or near the end or the counter antihistamines to attenuate the symptoms that you will be experiencing. And then obviously, as Dr. D mentioned, certainly monitoring the amount of pollen count that's out there, and trying to limit the outdoor exposure on those days where the pollen count is extremely high, can be a mitigation strategy that you can adopt. But again, you can't just stay indoors all the time, right? Because that's also not healthy for you either. So, but yeah, no, there's not, aside from the nasal sprays and the antihistamines, there's not a lot that you can do over the counter and nasal rinses that will really change that. You could potentially take extra showers, especially if you're going out and coming in, to wash off the pollen. That sometimes does help in some children. So sometimes I do employ that. But really, that's pretty much the gist of allergy pollen avoidance at this point.
Anything else you want to add, Dr. Decotiis?
No, I was just going to say, and again, this is somewhat controversial, but I'm a pretty big fan in allergy patients, mostly perennial allergy patients with indoor allergens, but the great majority of people with seasonal allergies also have indoor allergies. And I'm a big proponent of HEPA air filters. When I was trained, the doc always said, you spend 8 hours of your life in your bedroom, so concentrate there. I mean, the allergic reaction is not a reaction to one pollen; it's a cumulative response. So as it gets worse and worse, the nasal mucosal membranes are broken, inflamed, and then it gets a lot easier to have worsening symptoms. It feeds into itself. So, if you can spend 8 hours in a non-allergic environment, then your tolerance for the things that are outside is going to be better. So again, it's about $100. You put it in your bedroom. It's inexpensive. It's usually quiet, and some people like the noise that's there. But I think air purifiers in the bedroom. I don't believe in whole house air purifiers. They're just not worth it. And you have to have the heat or air conditioning on for them to work. But a HEPA filter, a GPA filter in the bedroom is very often, and my patients report all the time that it was very helpful.
Oh, go ahead,
To add to that, I will say that dust mite allergies are also one of the big things that we see a lot, right? And dust mite avoidance should always be employed if you notice that you have perennial symptoms. And one of the best things that you can do for dust mite avoidance is obviously washing your bed sheets and make sure they're drying 45 minutes in the dryer. If you have large carpets, that might be your next home improvement project. Bed sheets with high thread counts that you can do to mitigate the dust mite exposure. And also, a fun fact is that dust mites are like tiny little cockroaches that drink water from the air. So if you lower the humidity to less than 30%, you're not really giving them a lot to drink. So you can also that's another strategy you can potentially employ.
And last question, just generally for the conversation we're having here today, because the pandemic is still prevalent in our society and in our state and even in our counties here at the Jersey Shore, for anybody who hasn't gotten vaccinated yet, especially those who do typically suffer from allergies, what would be your piece of advice or recommendation for anybody kind of on the fence about getting a vaccine while suffering from allergies?
I think there's a lot of different opinions on this, but for the most part, not totally, but most physicians are very much in favor of the vaccine in general. We have dealt with, and we are dealing with on a daily basis, including today, a number of patients who have either had reactions to the first vaccine and want to know what to do, or in the past have had what has been told to them as risk factors. For instance, initially, when the vaccine first came out, there was 2 patients over in Great Britain who had an anaphylactic reaction. Now, they never really defined what that meant, and they never really gave us any details about it, but they told us that means that patients who have had anaphylactic reactions or are very allergic are at higher risk for a reaction to the vaccine. That's not true, okay? That is not true. So we have not found that to be true at all. When we first started giving the vaccine here, we were going over every Thursday to Brick Hospital. We're next to one of our offices, and we were sitting there while they were giving vaccines to high-risk patients. We wrote a questionnaire for them to ask the patients, and as time has gone on, we found that a number of the questions that we asked were not relevant. There is no question that patients do have reactions to the vaccine. If you look at the safety of the vaccine, however, these vaccines are among the safest that have ever been made. It's a personal decision. I'm a big I'm a big personal freedom person, and I don't think anybody should be forced to do anything. On the other hand, you shouldn't be allowed to put somebody else at risk because of your decisions either. So the fact that you have not gotten the vaccine is putting your friends, your neighbors, your family, et cetera, at increased risk. And you really have to deal with that. I've seen several horrible cases where people were adamant about not getting the vaccine, brought the vaccine home, and resulted in an unnecessary death. So I think that again, the vaccines by and large are very safe. We actually have given vaccines even today to patients who have had anaphylaxis, and someone who actually said they had anaphylaxis to the vaccine. A careful history and physical and et cetera determined that we didn't think that was the case. Now, whenever we can, if there's an underlying part of the vaccine, we do test for components of the vaccine. So some people are allergic, for instance, to polyethylene glycol or polysorbate. Those patients really shouldn't have that vaccine. And we can determine from those tests, which are, by the way, not FDA approved. Nothing, even the vaccine is not totally FDA approved just yet. It's emergency approval. But we've been testing to the components of the vaccine. Several patients have been found to be positive, most haven't, and we can at least mitigate some of the risk by doing that. And we also get at least 2 or 3 patients a day who have had some kind of adverse effect from the vaccine or have a history of having really bad allergies and anaphylaxis. Our peanut allergic children, for instance, or adults, and tree nuts, et cetera. We haven't found it to be the case, and I think you'll agree with me, that those patients really have an increased risk. So that's one big factor. That's probably the most common thing why people call us and ask, because I had anaphylaxis, is it likely that can I not get the vaccine? And the answer is no. I think that getting in a hospital is a reasonable thing to do. I mean, we don't go over there and sit and waste our time anymore, but we're right across the street in the hospital. So if they have any problems, they just call us and we come over. So getting in one of the hospitals, and I'm sure most of them are affiliated with allergists. We are affiliated with Jersey Shore, and with Jersey Shore, Kimball, Community, and Brick. But we're right next to Brick, so I mean that's the easiest one for us to get to when somebody has a problem.
Right. Adding to that, I will say that if you have allergies, and remember, allergies and sometimes even allergic asthma go hand in hand. So if you're experiencing significant allergy symptoms and asthma symptoms and you were to get COVID, that could potentially lead to a more adverse outcome as compared to if you weren't suffering from significant asthma allergy burden. Now, one other thing is, and also if you're not vaccinated, we've all heard of all these new variants popping up here and there. You could potentially become that incubator where the new strain comes out that might be more resistant or more infectious. And so that's another consideration that people should take when considering a decision to get the vaccine.
Right. I think a point that I always make is people just assume they don't really have a perception of how a variation occurs, how a mutation happens. Mutation in a virus can't happen in the air. It can't happen on a desktop. It has to happen in a rapidly progressive illness in a patient as the virus replicates very quickly. So that the more people who are ill, the more likely we are to get another variant. We have another variant now in South America. We don't know exactly. I think it's going to be okay, and it certainly has responded to the vaccine so far. But we never thought that the Delta variant was going to be this widespread either. And one of the characteristics of the variant, it being the case that not only does it spread more easily, but it actually replicates more quickly, and the viral load in the nasopharynx, where in the throat, is greater. And that's one of the reasons why it spreads so much with a cough or a sneeze or et cetera. There's more viruses there. It's the different disease for patients who have been vaccinated. Patients who have been vaccinated, by and large, are fine with this disease. Not totally. People have died, but it's not the same rate as it was with the first disease. So again, getting the vaccine is our only hope, getting everybody vaccinated, of breaking this vicious cycle. We're going to go through this year after year after year, fighting one variant and another, unless everybody cooperates. Need to take that into consideration. If you're not vaccinated, again, no reason to think that these vaccines are not safe, no matter what you hear, on the media.
Excellent points with the vaccine, the side effects, and just allergies in general. I appreciate both of your times, Dr. Decotiis and Dr. Patel, with talking about the summer to fall allergies, and then certainly here at the end with the importance of getting the vaccine and spreading that message to family and friends as well, so that we're not going through what you were just saying as well, the idea of battling one variant after the other. So thank you both for your time today.
Well, thank you for giving us the opportunity, because what patients are saying about not getting the vaccine most often is they don't know who to believe.
It's very true.
Believe the doctors.
Yes.
Thank you.
Okay. Thank you very much. Take care.
That is Dr. Bruce Decotiis and Dr. Chirag Patel. I am Vinay Banu here for Eyes on the Jersey Shore, and thank you all for watching. Get vaccinated, stay safe, and stay healthy.